All right. You can tell that's one of my favorite jams. All right. Well, welcome. I am going to share my screen so we can get started. Thank you all for joining me. Let me know when you are able to see the presentation. Welcome to Full Circle Women's Care Practice and Pregnancy Orientation. I'm your host, Dr. Adams. Some of you had your history visits today. Hi. Some of you met with me earlier in the week, and some of you may be meeting with me tomorrow. So we are going to jump right in. Hope you got your notes with you and you're ready to ask questions and answer questions. Couple housekeeping rules. First of all, this is confidential. Nobody will know who's asking the question. I'm not going to say your name. I will know who was on the call because I'll get the report later on from your email addresses. But if I think it's something too personal, then I'll say we'll delay that until your visit, like if someone can figure out who you are based on that. So please participate. I have some poll questions hidden throughout here to just kind of keep you engaged. And then if you have to hop off at any point, I know we might run into dinner time. The rest of the presentation, the whole in its entirety, will be available on our YouTube channel at Full Circle Jax for the duration of your pregnancy. So we are going to start off with an example of our poll questions. So the first one, you'll see it kind of pops up like this, and I want to know who's on the call. So how many first-time moms do I have? How many mommy veterans do I have? You'll hear me talk for a little bit to stretch, and then I'll say the polls are closing in 4, 3, 2, 1. And I will end the poll and I'll share the results. And whoa, this time the mommy veterans way outweigh the first-time moms. Okay, all right. I don't think I've ever had one with this much of an imbalance in favor of the mommy veterans. So that kind of helps me with what we're going to discuss next. So you kind of help me to guide what we're going to say. So we are going to discuss today the full circle experience, which includes where we deliver. We'll go through some of our office protocols, talk about what to expect at each visit. I'm going to give you lots of prenatal resources. We're going to go over exercise and nutrition in pregnancy and end with a COVID and upper respiratory infection update. So let's start with the philosophy of our practice. We are a collaborative midwifery model practice, which is based on the premise that pregnancy and birth are normal life processes. They are not, it is not a disease of which we must cure you. This is something that is supposed to happen in order for life on earth to continue. The traditional midwifery model also operates on this premise, but they care for normal, low risk women. And if they identify certain abnormalities, you have to transfer out of care and lose access to the midwifery model of managing labor. In the collaborative model, it allows you to stay in the care of midwives with physician direction for any abnormalities or complications of the pregnancy. To that end, if you're having a normal labor, there is a good chance or a possibility that your labor may be attended by one of our certified nurse midwives. So you'll be rotating through to meet each one of them because we do rotate call, and we don't know which one will be on call when your little one decides it's his, her, or their birthday. If there is something outside of the scope, though, there's always someone from our group who's on call behind the midwife, too. If it's something urgent, like it cannot wait until the morning or something to be scheduled, then they call one of us, the full circle physicians, to come in. We are each about 15 or 20 minutes away from the hospital. If there is something emergent, like we don't have 15 or 20 minutes, where we deliver, there are OBGYNs, board certified physicians who are in-house 24 hours a day for true emergencies. And for perspective's sake, in 2023, we did about 550 deliveries, and about 3 of them were involved with the hospitalists. And the most common reason is actually not a bad emergency, but the type of emergency where even the midwife didn't make it. You got to the hospital at 10 centimeters and were pushing out a baby before any of us were able to get there. So please don't do that. Where do we deliver? We deliver at HCA Florida Hospital, which was previously known as Memorial Hospital. It is on University Boulevard, less than 10 minutes from from the office. They do tours. They do 2 types of tours. So they do one-on-one tours. There's a phone number we can give you to call, and you can arrange to have a tour, a personal tour in the evening or a weekend. But they also do this quarterly tour. It's called the Stork Tour. It's very cute. It's like a baby shower, and they raffle off prizes, and I come and speak, but we take you up to the unit in groups, small groups, so that you can see the unit, meet the nurses, kind of get a walk around and feel where you're going to be, figure out where you're going to park Park. It's a good idea to do this before you deliver. The next one they're going to have is May 22nd. So when you come in for your prenatal visits, you'll see a sign on the wall that tells you that the next upcoming stork tour is on May 22nd. Be sure to take down that phone number, give them a call, and register for the tour. Most people on this call are very early in their pregnancy, so if you miss the one in May, don't worry, there will be another one or possibly two before you deliver. Our office is open Monday through Thursday from 9 to 1. We close for lunch between 1 and 2, and then we reopen from 2 to 5. So if you are calling between 1 and 2, the phones are rolled over to the after hours voicemail. Don't worry, it's not broken. The reason we do that is because the after hours voicemail allows you to reach the emergency on-call provider if you have a medical emergency between 1 and 2. So we do ask that you don't leave administrative messages on the voicemail between 1 and 2 because the on-call provider is in the hospital taking care of people in emergencies and she's not going to relay those messages back to the office. Just wait till we reopen at 2 and you can talk to the front desk staff. If you are leaving a voicemail for the emergency on-call provider, obviously, though, she will give you a call back about that during those hours. On Friday, we are open from 9 to 1. So if you are calling with an administrative matter at 12:53 on a Friday, we may get an answer for you when we reopen on Monday at 9 a.m. For appointments, we do not have walk-in appointments designated because our goal is to see you at as close to our appointment time as possible. We try to respect your time. So if I promised you the 9:40 appointment and someone else walks in at 9:25 and says, I have something I really need to be seen right now, that's not fair to you, my 9:40 person who is blocking your time. And so we ask that you respect your fellow patients as well. We do have limited same-day appointments. People deliver, people have to cancel, and sometimes appointments do open up. So if you're calling in sometimes saying, well, I think I really need to be seen, if it's something that can wait to be seen later in the day, the front desk might look at the schedule and say, oh, you know what, there's actually an 11:40. Can you come in then for that? Because again, we want you to have a set appointment time and not be a walk-in just waiting to get worked in. If you're calling with something that's more urgent, like you're calling at 9 a.m. saying, I don't feel my baby move, can you guys check me out? And there's not an appointment until 3:40, that shouldn't wait for 6 hours. So they may recommend that you actually just go to labor and delivery, or if it's some other matter, they may say, like if you're having chest pain or shortness of breath, don't wait 6 hours with that. They may say you need to go to an urgent care. It's not us saying that we don't want to see you in the office. It's us agreeing that this is an actual more urgent matter and it should not be sitting in our lobby waiting to get worked in. When you call, the providers are unable to leave patient appointments to take phone calls. So if you're calling with questions about your health, we do have a nurse who takes triage calls. Sierra knows a lot of the same things come up in pregnancy, having some contractions, not sure if my water broke, that sort of thing. So she's able to triage those. If there are things that are outside of her scope, she knows how to get in touch with the on-call provider to ask her questions. But again, if we promise that we're talking to you at 3:40, someone who calls in at 3:38 with a question about spotting doesn't get to take your appointment time. When you do call, though, please be sure that you leave a message in the right place to ensure that you receive the appropriate call back. So Sierra is our pregnancy administrative person who also does triage phone calls. She does some letters and forms. So if you have things like FMLA, disability, Sierra's the one taking care of those. Our OB clinical coordinator, many of you have already had some interaction with Naisha. She's the one who sends your labs. If you have a referral that needs to be sent, like you're seeing the high-risk doctors, or you're going to see a cardiologist or hematologist or whatever, or if at the end of pregnancy you need something scheduled, anesthesia consult, neonatal consult, induction, C-section, Naisha is your girl. Most of you have also already met with Renee Hall. She's our benefits coordinator, and she's the one who needs to be notified if anything changes about your insurance. So if you have a big trip to the ER, hope you don't, or somebody in your family does, and you meet the family deductible, you probably no longer need to be paying on your prepayment plan here. Let Renee Hall know so she can recalculate things because it's not our intent to continue collecting on something that we don't need to. So if anything changes with the insurance or you don't understand any bills that you have, definitely reach out to Renee Hall. After hours, there is always someone from our practice on call for our practice, and that is the emergency on call provider. So, this is the person you call if you think you need to go to the hospital. This isn't someone where you say, I think I need a refill on my iron pills. This is someone who is taking care of emergencies in-house. And so if you think you need to join her in-house, then that is who you give a call. But you do have to leave a voicemail, otherwise the phone doesn't even register that a call came through. You just call the regular phone number to the office and follow the prompts to reach the after hours provider. The patient portal is also another way to reach us, but please remember that response times can take up to 2 business days. If there's a non-action item, like, I was thinking about switching my prenatal, I have a list of them, or I have a list of supplements or what have you. Those are items that can wait until your next visit. So we might forward that message to the next person who's going to see you in the office. The portal is best used for things like, I lost my lab slip. I know I need to go to Quest, and the last time I went, they didn't have my orders, so I just don't want to walk in without a slip. Or I have a dentist appointment in a couple of days, and I need to get a letter saying that it's okay for me to get certain medications. Or I have a cold, I have COVID, and I need to cancel or convert my visit to virtual. As long as there are 2 business days between you sending the message and you needing a response, the portal is an appropriate way to send those. We ask that you do not send urgent matters, because remember, 2 business days. If your blood pressure is really high, if you're not feeling your baby move, if you're bleeding heavily, the portal is not the place to communicate that. Some spotting if you're not really worried about it, but you just kind of want to hear a little reassurance and it can wait a day or two, that's okay. But when I open the portal and I see my blood pressure is 160 over 100 and I have a headache, what do I do? Dot, dot, dot. And this was 3 days ago, because you send it on a Thursday and the next 2 business days is Monday, then my blood runs cold. So please, those are phone calls. Those are not portal messages. Please also don't blitz message. So that is when you send a message to Jane and Lauren and me and Dr. Mooney, and you cut and paste the same thing because you're like, I don't know who's going to answer first. Well, what if we all answer? We had some people very upset. They had 5 prescriptions waiting for them at the pharmacy. If you message 5 people, that is a possibility. So it's kind of abuse of the portal because there are multiple patients that we need to be answering. And if all of us are working on one, it's not a good use of our resources. So multiple messages to one person or multiple messages to different people. We ask that you just wait the 2 business days. If you realize it can't wait 2 business days, then maybe it is actually a phone call. So we ask you not to use the portal in that way or to try to have a visit. If you are sending pages and pages of information and saying, hey, take a look at this and tell me what you think, that is a visit. That is something that we do in the office from 9 to 5. So the portal is really for after hours, after we've seen all our patients, done all our notes, reviewed all our labs, looked at our ultrasounds. We want to spend some time with our family. We don't want to then open the portal and do 20 more mini visits after hours. So text yourself questions that can wait until your next visit or schedule an appointment. We'd be happy to look at the labs and tell you what we think. We also use the portal to release ultrasound reports unless there is something urgently abnormal. So if there's something urgently abnormal, we always discuss those on the same day. Otherwise, we have to, it's like we send you to an outside facility. The sonographer creates her reports at the end of the day, sends them to our electronic medical record system. We upload them and distribute them amongst the providers and then send them out to you after reviewing them. So give us a couple of business days after your ultrasound appointment to get the official final results. If you know that your anxiety is not going to let you wait 2 days to find out what was on that ultrasound report, please be sure you have a visit on the same day as the ultrasound visit or a prenatal visit on the same day as the ultrasound visit, because we can get a preliminary report and go over the thing that you're really concerned about. Otherwise, just give us a chance to receive the report, review them, and respond. You'll see Kathleen and Taylor just typing away and it freaks you out. You go to your car and say, what's on my report? We don't know yet because we don't have the report yet. Quest also has a portal, and they will sometimes send the results to you and not to us, or send them to you first. And then you open them and you see all this red on it and it freaks you out. But just remember that red doesn't necessarily mean abnormal in pregnancy. The reference ranges that they're using are for non-pregnant people. And in pregnancy, there are some physiologic changes that will move your creatinine or your hemoglobin or whatever outside of the range of normal. So give us a chance to receive the labs from Quest. Please don't upload your copy and send to us. But give us a chance to receive them from Quest so we can close our loop saying that they were done. Let us review them and release them to you. If you've had the results for over a week and you still haven't received them from us, then definitely let us know, because on rare occasion, you will get them and we don't get them at all. One of the rare occasions, though, is because a different name is used at their facility than at our facility. So we ask that you please pick one name and carry that name throughout the rest of the pregnancy. Or if you decide that, if you're changing your name, because sometimes you get married, you just haven't gotten around to changing everything. Whatever the name is on your insurance that you're going to be using at all these places, use that name whenever you go to the hospital, come to us, go see specialists, go to the lab. What happens with us is we send you to do these things, and then the report gets sent back with a different person's name. Well, our electronic medical record system only knows you as Susie Smith. They don't know Susie Johnson. And so Susie Johnson's report doesn't get sorted into your chart electronically. It gets sent out into this limbo area, and we don't know what the report says. When you use a different name at other places, it guarantees delay of our receipt of your information. So please pick a name. And even if you are a Smith in your heart, you're a Johnson with your insurance company. Any questions about those couple of protocols? All right, cool. Let's go to prenatal visits to talk about what you're going to expect. So first thing, expect that you are going to forget all of your questions. So please start a text thread with yourself that has all of your questions in it, so that after you come in, we do your vital signs, we go over blood work, ultrasounds, or whatever. It's your chance to ask us what's on your mind. We want you to wear loose, comfortable clothing so that we can access your belly, because we will be listening to baby's heartbeat at every visit. Not an ultrasound, but listening with the Doppler to make sure that the heart rate sounds good. We'd love for you to arrive about 5 minutes before the scheduled appointment time. That gives you time to check in at the front desk, handle any of your business there, and if you need to use the restroom, to go ahead and do that before the appointment time. Not everyone needs to leave a urine sample. We used to do that routinely, but the American College of Obstetricians says that's no longer necessary. So we will be checking. You'll know if we need to check urine on you. This is usually on someone who we're following you for blood pressures, looking for protein in the urine, or for blood sugars, looking for sugar in the urine, glucose, or if you had a recent urinary tract infection and we're testing to make sure that you are cured. Otherwise, we know you're pregnant, you've been drinking water all day, you have to go to the bathroom. So when you come in, go ahead and do that before your visit, so you have your entire time with your midwife. If you're 10 minutes late, we'll have time to check on you and the baby, but that leaves less time for our text thread questions. If you're 20 minutes late, you missed the entire appointment slot, and we may be able to work you in later in the day. Front desk is really good at looking and saying, she's not going to make it for that 2 o'clock, but I see this one over here has a 2:40 open. Let me just slide her into that space. If when you get there, that time doesn't work for you, no big deal. Just let us know and we can work you, we can reschedule to a time that's mutually good for all parties. So the question I get a lot is, when am I going to have another ultrasound, Dr. A? That was so much fun at my confirmation. Yes, it was. Diagnostic ultrasound visits are separate from your prenatal visits. So again, we're not doing them at every single visit. The way to know whether you're scheduled for an ultrasound is to look in your portal and see if you have more than one appointment time. And is there a provider's name associated with your visit? So my imaginary patient, Tina Test, logs into her portal and she takes a look at appointments. And when she clicks on that, she notices that she has 2 appointments. So Tina must have an anxiety that says she can't wait 2 business days. So she is going to have her ultrasound at 9:20. She can have her family meet her there at 9:20 to come in and see the baby. And then afterwards, she'll have a visit with Dr. Yeckel at 10 a.m. So she will be able to go over a preliminary version of the report, and then she'll get the final report on the portal a few days later. So remember that the results are sent within a couple of days. Unless there's something urgently abnormal, we will not let you leave the building if we know that there's something that requires a plan right now and today. When you're checking out of your regular appointments and your provider just said, hey, it's going to be time for your ultrasound next time, we'll see you in 4 weeks for your ultrasound, let them know when you need a prenatal visit and a diagnostic ultrasound. Be sure you have 2 separate appointments scheduled. If you want to look at your baby more than we medically need to diagnose anything, there are boutique ultrasounds. So boutique ultrasounds are just fun views of the baby. These are a couple on here for informational purposes, not endorsing any one over the other, but I tried to put them in different areas of the city. I know there's one in St. Augustine too, but these are, they do really cute stuff. They'll put the heartbeat in a bear and they do 3D ultrasounds and all of that good fun stuff. So just know that you can look at your baby at any time, but if we don't need to make a medical diagnosis off of it, then a fun ultrasound is probably better for you anyway. So our next poll question is, when should you expect routine ultrasounds? Are we going to be doing them at every visit? Do we do them at 20 weeks, your due date in 41 weeks, or do we only do ultrasounds if you have a problem? And the polls are closing in 5, 4, 3, 2, 1. Awesome. All right. I think this may also be the first group that everybody got this right. Yes. So your anatomy ultrasound is done right around the 20-week mark. If we see everything that we need to see then, we don't need to do any more. So this is about routine ultrasounds. If there is something we identify at the anatomy ultrasound, say the placenta is not in the right place, or maybe baby was in a weird position and we couldn't get all the heart views, then we may repeat the ultrasound in a few weeks later. But that is not routine. So routine ultrasounds are done at the 20-week mark, and then unless you go past your due date or develop any other complication of pregnancy, you would not need to have another one. All right, so we are going to slide over right now to our website. So let me know if you're able to see Full Circle Jacks, the website. I think that's what I'm sharing. Okay, fantastic. All right, this is fullcirclejacks.com. So the next couple of things that I'm going to go over will be available for you to look at forever and ever, actually. um, All right, I have the chat out here, something in the chat. I see Zoom. Oh, thank you so much. All right, let me see. Let's try this. How about this? Is that better? Okay, thank you. Thank you. Technologically challenged a little bit. Really good at being a doctor, not great at being a web host. Okay. All right. This is fullcirclejacks.com. Thank you for your help. We will start with the providers. So this is our page that shows you some of the wonderful people who will be around to help you meet your little ones and grow your family. So all of our bios are on here too. So feel free to click on there and learn more about each of us. Because we like to know, because we know a lot of stuff about you. So feel free to learn a little bit more about us as well. Over here under patient information, you'll see the obstetrics tab, and you'll know you're in the right place because you'll see all the growing bellies and then the baby here at the end. So a lot of good information here. A lot of you are here because of this box right here, our delivery stats. So a lot of you are some of you are first-time moms who are trying to avoid an unnecessary first-time cesarean or looking for a certain birth experience. Some of you are moms who had C-sections and are trying to avoid a second or third cesarean. And so this is where we see our VBAC success rates, our labor to cesarean conversion rates. Our numbers here go back to, I think, 2018. So feel free to peruse that at your leisure. We're going to take a look at the prenatal care timeline. So this tells us what to expect at each visit. So everyone on here has had this visit, your first prenatal visit. It is 8 to 10 weeks where we do our pregnancy confirmation. You had an ultrasound with Taylor, you met with one of the midwives, and we set the due date. Following that visit, you will have a virtual visit with me, and some of you have already had that as well, where we go over your medical history and, if applicable, your pregnancy history. At your first visit, you talked to Renee Hall and went over any insurance things and asked those questions. And then when you meet with me, according to what we find out in your medical history, I might order some additional labs, but everyone will get orders for the standard prenatal labs. And we're very transparent about what labs are ordered here. So you'll be able to see what should be ordered when, and you can always ask whether or not these things apply to you. And then I give you some homework to have your blood work done before we see you at your next visit if possible. Those of you who opted into doing the genetic testing, and we can talk more about what the options are in your history visit and which one makes more sense for you. Those who opt into genetic testing usually do that on or after being 10 weeks. Those who do the nuchal translucency ultrasound will do that around 12 to 13 weeks. At this point in the pregnancy, we're seeing you every 4 weeks. So about 4 weeks after your initial visit in the office, you're back in the office for your OB physical exam. And it's just like it sounds. It's a regular physical: heart, lungs, breast exam, pelvic exam. It does not necessarily include a pap test. So the pap test is a screen for cervical cancer. That's not part of your initial standard blood panel, but we do need cervical cultures. So if you do not want a speculum exam, you can do a self swab to get your cervical cultures. Some people are due for a pap and they're like, well, if you're going to be down there anyway, go ahead and collect the pap. And so we're happy to do that for you, but it's not required as part of your prenatal. If you need to see a high risk doctor for anything, this is around the time that they usually start seeing you. And so when you meet with me for your history visit, I will typically send the referral to your high risk doctor. About 4 weeks later, you're back in the office in second trimester. But funny how quickly that happens. We talk about regular second trimester stuff. You start feeling the baby move. We talk about round ligament pain, all that kind of stuff. And then 4 weeks later, roughly, is your anatomy ultrasound, which we do between 20 and 22 weeks. You'll see here in the middle a couple of extra things. The mental health screen. So postpartum depression, postpartum anxiety are well known. There is antepartum depression, antepartum anxiety. Not everybody has those warm, fuzzy feelings about pregnancy, and people who have a history of it may be at increased risk for having it after delivery. So we want to get ahead of it and identify early. So we do depression and anxiety screens about midway through pregnancy, around the time of your anatomy ultrasound. Your midwife will also start talking to you about the options for childbirth education classes and breastfeeding classes, which we'll talk about in a moment. Then about 4 weeks later, we do the glucose test, and I know I have questions about that, so just hang on, we're going to get to that. My moms who have a blood type that is Rh negative will make sure that we either know what baby's blood type is, what dad's blood type is, or get RhoGAM for you to take between 28 and 30 weeks. This is when we'll have you fill out your pre-admission forms for the hospital. You haven't already done one of the stork tours, hopefully have you go on one of those. And if you plan to work with a doula, actually the doulas have asked me to move this from down here up to first trimester because they want to hear from you sooner than your third trimester. So we'll be changing that later on this screen. Then we start seeing you every 2 weeks. So after 28 weeks, we ramp up to every 2 weeks. You'll see here in the middle the option to repeat or decline your standard prenatal labs. While the American College of Obstetricians doesn't necessarily require the repeat, Duval County Health Department for certain high-risk populations recommends it. So if you feel that you are not in a high-risk population, we do have a form to sign and opt out of repeating those. For those who intend to get vaccine boosters during pregnancy, early third trimester is the best time to do it because it does give your body and your baby enough time to make antibodies in order to pass them through breast milk. For first-time moms, you want to decide who your pediatrician is going to be. They do meet and greets, so you can find out who in the city matches up with your philosophy. For those who develop any high blood pressure or diabetes or other issues with pregnancy, we start doing some fetal testing in pregnancy. And then for those who are anticipating a baby birth, all of you, a belly birth. A belly birth is our word for the C-section. We try to get those scheduled around 32 or 33 weeks so that you can start planning. And then we start seeing you every week. So at the 36-week mark, we do one more pelvic exam to screen for group beta strep, and we'll explain what that is and why it's important. If you've opted out of repeating your standard prenatal labs, you can also opt out of repeating your cervical cultures. But the weekly appointments start here because at 37 weeks, you are full term. So if you have a birth plan or birth preferences, you want to bring those in for discussion. We're also going to talk about your natural cervical ripening methods in just a moment. And then for the belly birth, the latest that we usually will schedule is 39 weeks. Depending on your circumstances, we may have to do it as early as 37. But again, that's individualized. For those who are waiting for baby to give the signal for labor, be patient, be patient. If you go past your due date, as I mentioned, that's when the ultrasounds start again, our post-dates testing to make sure that it is safe to continue. And then we like all passengers out of the car by 42 weeks. So for first-time moms, 41 weeks and 5 days is when we would schedule induction because average length of labor for first-time mom is 24 hours. Sometimes it takes us 24 hours to get you into labor. So it's not unusual to be in labor or in being induced for 2 days. For second-time moms, usually it's about half the length of the first one, so 41 weeks and 6 days for you. So remember, this is out there on the website. The next box we're going to take a look at actually comes with a poll question first. So if you have a headache, what are you more likely to do? Are you going to meditate it away? Are you going to go grab a Tylenol? Or are you going to head out to the emergency room because headaches? I've never had a headache. Polls are closing in 5, 4, 3, 2, 1. Done. Awesome. All right, today we have more meditators than medicators, but fortunately, no evacuators. No one is leaving the house for a headache. All right, pregnancy safe medication. Some of you I've talked to have said, oh, I'm so nauseous. I have constipation. Nobody told me pregnancy was this sexy. It is. It gets sexier too. Here's a list of common pregnancy discomforts in alphabetical order. And first, there are some relief measures on here. So if you send us a portal message, Dr. A, I am so constipated, I just don't know what to do. The first thing I'm going to ask you is, have you tried every relief measure and every medicine that's on our list? And some of you have gotten smart and you'll send me a message saying, okay, Dr. A, I've already tried everything on the list and I still have hemorrhoids. And so if you've tried everything on both columns here, then definitely reach out to one of us because it may be time either for an exam or for us to prescribe something. So, there are also some caveats on here. If you have nausea and vomiting, you can't keep down fluids for more than 24 hours. Please don't keep trying C-bands and ginger staggering around. We need you to come in and get some IV fluids. So definitely pay attention to the things that we want you to not do when using this list. But this is out there, and remember, you always need this list at 3 o'clock in the morning. Not sure why that always is, but be sure it is someplace accessible. Gestational diabetes screening, we are going to come back to this, I promise, but I'm clicking on it really fast because, again, some things I'm going to go over today you won't need for several months. So remember, this is for 24 to 26 weeks when you're doing your glucose testing. Remember, this information is out here because this gives you all the instructions on what to do when it's time to take your glucose test. We will click on this one regarding weight gain and pregnancy because some of you are very distressed that all you want to eat are carbohydrates. It's okay. And that you may be gaining weight now. Or some of you are concerned that you have a lot of food aversions and you may be losing weight. Don't stress out. First trimester is survival mode. If you look at this, it does tell you what your recommended weight gain is for your total of pregnancy. If you have twins, you get to add 10 pounds onto the upper number over here. But this is a link you can click on to put in your pre-pregnancy weight and height, and it will tell you what your body mass index is. And based on that, it tells you what your recommended weight gain is for the duration of pregnancy. But really pay attention over here in this last column. The rates of weight gain are in your second and third trimester per week. So we're not really counting what happens in your first trimester, but this is where we're looking for you and baby to gain most of their weight is in the second and third trimester. So just make it through however you can for your first trimester. The next box that we clicked on was our birth preferences. So this is our template for a birth plan. And a couple of things that I want to highlight here, especially for first-time moms, you've never done this before, so you don't know what you don't know, and everything can be anxiety-inducing. Sometimes writing things down kind of helps you feel like you're regaining some control of the process. So this has a lot of different things that it addresses about what happens in the hospital. What do you want to do about how labor starts? What do you want to wear when you're in the hospital? How do you want to be monitored? Of course, it's a hospital, so we have all sorts of different ways to relieve discomfort. The nitrous is not available quite yet. We are still working on it. It's in the building, but we're still working on the policy of who owns the nitrous to be able to give it to you. But we're not strapping you down. We're not starving you. We want you to move around and be an active participant in labor, assuming your baby's heart rate is good, your blood pressures are fine. So laboring in any position, pushing in any position, delivering, that's not a big deal. Our standard is delayed cord clamping. Let us know if you're trying to do stem cell collection. We can, balance those things for you. These are the routine medications offered to the newborn. You always have the option of coming in and asking the midwife, well, what is this for? And do I need this? And what's the risk of not doing this or that? If you're, as you're making these decisions. Looks like a lot of things on here, but not every box applies to everyone. You might not be having a boy, so you don't need box 18. You might not be having twins, don't need 20. Might not be having a belly birth, so you don't need 21. But just take one box per week and just kind of look up what things are salient to you in a birth experience. And if you have a doula, they can help you walk through it. And then after the 36-week mark, you'll bring it in and we'll go over all of it. So also our cervical ripening methods. So yes, this is our these are some things that you can do. These things don't put you into labor, but what they do is help to possibly tone the uterus, or they may help to make the cervix softer so that when baby says, all right, it's my birthday, your body is ready to respond to that signal. So you can see on here everything from raspberry leaf tea, there's acupressure, eating dates, using the breast pump, using evening primrose. So you can just see all the different things on here and what weeks we recommend that you start them. So remember that that is out there. And also remember that castor oil is not on that list. And definitely be sure to ask your midwife why that is. The next box we're going to open up is for first-time moms and for trial of labor. Do I have anyone on here who had a C-section before and is trying to go for a vaginal delivery this time? All right. Okay, cool. We have a couple of VBAC moms out here. Oh, quite a few. All right. Polls are closing. 523, 54321. Awesome. Okay. Yes, VBAC mamas, I hear you. Okay. All right. So the next slide that we are showing is for first-time moms and moms who had a previous cesarean before. Control what you can. As you know, babies are going to baby, but there are things that you can do to reduce conversion to a cesarean. So if you had a delivery before and it's weighing on your head, many of you know I'm a VBAC mom. Dr. Mero is a VBAC mom. Midwife Lauren is a VBAC mom also. So just if you're struggling with your last birth experience, don't let it sabotage your next one. There's a doula who does fear releases. Ask us about her. We can give you her information. If position of the baby was a problem last time, you want to look for a Webster certified chiropractor that we'll talk about. But you can read all these different things. An experienced doula, I cannot stress the importance of enough. Do not cheap out on this part because you do get what you pay for in terms of doulas who will help you to get your baby in a good position. Watching your weight, doing your squats, all that stuff. Don't get exhausted with pregnancy and demand to be induced at 39 weeks, first-time moms. That is the biggest problem that first-time moms that we run into is that I'm tired of being pregnant and everything hurts and it's been a problem forever. And you get non-medical inductions, which may increase our risk of converting to cesarean. So trust your body and trust us because I have really good stats and I don't want you to mess them up by doing things that lead us to a C-section. And finally, if you have a little guy and you want to have him circumcised, we do these in the office, not in the hospital, for the first 10 days of life. So what typically will happen is after you deliver, we will reconfirm with you that is what and that's what you want. And then Naisha will send you a message and we'll get your little guy an appointment, one of his first little appointments. All right, awesome. Okay, so remember all of this is out here on fullcirclejax.com. And now I'm going to see if I can go back and share again. All right, so let me know, am I back on the presentation now? Can you see my favorite drink? Okay, sweet. All right, so for those who are concerned, we've gained so much weight, but all we're having in the morning is coffee. Are you, or are you having coffee? A salted caramel mocha monstrosity, as I call it, is full of all of the bad things. Did you know that pregnancy only requires an additional 300 calories per day? So Aunt Sally, who keeps trying to put more food on your plate, saying, girl, you're eating for two. Don't listen to Aunt Sally because the American diet, we're already eating for two. It takes 10 calories to maintain 1 pound of body weight, and your recommended weight gain is based on your starting body mass index. So if you're starting your pregnancy at 170 pounds, it takes 1,700 net calories to maintain that. If your goal is to gain 25 pounds during pregnancy, that is an additional 250 calories for a total, for example, of 1,950. Let's divide that between breakfast, lunch, and dinner, and that's 650 calories per meal. total. So if you're having a mocha monstrosity, remember that was 570 calories. So then you can have like an apple with that, and that's your meal. So don't eat your meal and then drink your meal to follow, because baby's going to take their 300 calories in the beginning and the rest goes to you. Happy Mother's Day. But at the end, baby will also start to take some of those calories and we will get a big chunk or baby. This is a busy slide, but it's a good slide because I just say calories, but what's important is where these calories are coming from. So you can see this one, 485 calories, but 220 come from fat. That's not a good choice. So we want proteins, we want an appropriate number of carbohydrates. And then over here, just making small choices, small changes can make a big difference. So in cutting sodium, going from traditional spaghetti sauce to 20-minute herb infused marinara cuts out 500 milligrams of sodium per serving, and that is major. So, what things should you be eating? Your fruits, your veggies, your whole grain, your cereal. You're not going to give your baby a nut or dairy allergy if you eat those things. So, go ahead and enjoy. For my coffee drinkers, you want to keep your caffeine at less than 200 milligrams daily. Do remember that caffeine is a diuretic, so using the 3-to-1 rule is very helpful. 3 times as much water as caffeinated beverage is very useful in staying hydrated. Also, excess caffeine in third trimester can give baby irregular heartbeats. So really, if you can wean down in third trimester, that's even better. Herbal teas are fine. Some of our favorites in pregnancy are, as I mentioned, raspberry leaf, but there's also ginger, lemon, and peppermint. For my vegetarians or pescatarians, you want to keep your protein intake up around 70 grams daily. There are some pregnancy diets that tell you to eat 125 grams of protein a day. Please do not do that. They all have 10 or 11-pound babies, and let's just not add another layer of complication to the situation. 70 grams is plenty to sustain a normal pregnancy. You can have deli meat. Just be sure you're microwaving it for 30 seconds. It doesn't have to be piping hot out of the microwave, but be sure you do it long enough to kill the bacteria, just 30 seconds. Your soft cheeses, as long as they are made with pasteurized milk, are fine for you. If you're at a restaurant and can't verify whether it's pasteurized milk, then perhaps you skip the brie for the evening. Canned tuna, you can have 3 4-ounce cans for the week. If you are pescatarian and you have more questions about fish, the FDA has a really nice document. It says 2021, but this is the most current iteration of it. For fish that you should be eating in large amounts because it's high in DHA, which is good for baby's brain development. Fish you should eat in moderation because it's plus or minus, and fish you should avoid because of higher methylmercury content. You also want to avoid undercooked fish. So if you are a foodie like me and you love your ahi tuna or your medium steaks, you will need to ruin your steaks for the next 6 months and make them well done. For my kombucha drinkers, my kimchi eaters, those are fermented. Sauerkraut is fine as long as it is cooked. But if you're eating the raw ones, those are fermented. Your body may treat them as alcohol, so you want to limit those. For alcohol itself, there is no safe amount, so we do not recommend alcohol in pregnancy. And for sodium, you want to limit yourself to 1,500 milligrams per day. So now thinking back to that spaghetti sauce with 500 milligrams per serving, it makes a lot more sense why cutting that down to 45 can be a really big change. Any questions about food before we move on to exercise? Okay, y'all are my emoji group. I know you're still listening because I see the emojis, but very few questions. All right, exercise and pregnancy. It is fine for you to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing. It's time to start doing something, but you just won't feel like it in the first trimester, and that's okay. Second trimester, you're going to increase your blood volume by about 50%. So higher oxygen tension and saturation means you'll be able to do more of that aerobic activity. And just listen to your body. You will return to your former Olympian status. Then and we will you'll feel a lot better about doing it in your second trimester. First question I have up here. In Japan, it was okay for us to eat raw fish. Why is it different in the States? Things are processed a little different here too. And we may get our fish from sources that, as I mentioned, are higher in the methyl mercury. So you want to be sure that you're also cooking out any parasites or anything along those lines. And you know, honestly, I don't really know how stringent the regulations are in looking for parasites in Japanese fish as well either. But here, you know, mean, we try, yes, but you don't want to accidentally ingest a parasite from eating raw meats. If you weren't doing anything before, you can start doing something. So it's okay to start a new regimen. Sedentary lifestyle leads to malpositioned babies. And I will tell you, the most common reason that I do a C-section is not because baby is too big or baby is in distress. It is because baby is in there with a crooked head. So the head is down where it's supposed to be, but it's kind of flipped off to the side like this because the whole time mom was sitting in a chair and kind of slumped over, or baby is settled into the pelvis and the head is the face is toward mommy's belly. We want the face to be toward mommy's back. Those are the most common reasons, honestly. Those of you with these cute little Fitbit watches who are giving yourselves new reasons for anxiety, your heart rate, you're monitoring obsessively. You'll notice that your resting heart rate is going to be 10 to 20 beats per minute higher than it normally is. That is normal. That is physiologic. If you are not getting dizzy and passing out from it, don't let it freak you out. In terms of those who are saying that, well, I do exercise, I walk. If when you are walking, your heart rate is in the aerobic zone, then that is considered walking, and that's fine. And what is the aerobic zone, you ask? I thought you'd never ask. So it depends on your age. We start with the number 220. And if you're 30 years old, then your max heart rate is 190. So you should not be exercising for extended periods of time with a heart rate above 190 if you are 30. 70% of 190 is 133. So that's where your aerobic zone begins. So that is where your body begins doing the aerobic activity exchange of oxygen. So your goal is to exercise between 133 and 190 for 30 minutes 3 times a week. So if when you are walking, that is where your heart rate is hanging out, then your walking is exercise. If when you are walking, your heart rate is between 80 and 100, like it always is, then your walking is transportation. And perhaps you can transport yourself to the treadmill. And that's just fine because cardio. What cardio things do you want to do? Treadmill is fine. Elliptical is good. Running is good. Swimming, indoor bike. Like I really should take my Peloton leaderboard name off of here because it's become a clothes hanger. But maybe, if you follow me, I'll follow back and we can inspire each other to do some workouts. If you are lifting weights, you can lift up to whatever your pre-pregnancy level was. No need to increase the resistance because your baby and your body will be doing that. If you are already a squatter, please continue squatting. That is one of my favorite things to get that pelvis open and that baby in a good position. You want to build up to a minimum of 50 a day if you're not already doing more. If you're not already squatting, you want to start at 20 weeks with five per day. 21 weeks, give me 10 per day. 22 weeks, give me 15. If you can go over 50 per day, that's fantastic. They don't all have to be at the same time. Pilates and yoga are also two of my faves, and any experienced instructor will be able to tell you what the pregnancy modifications are. We do have a question out here. I had 2 slices of ahi tuna last night and totally forgot the rule. It's okay. Minimal exposure, we're just talking about risk over time. Like you probably did not get a parasite last night, but we don't want to keep spinning the wheel to possibly increase our risk there. So exercises you want to avoid are the high intensity intervals after your first trimester. And it's not the intervals, it's the intensity. You can do the low impact versions of these, but just kind of, easy on the shocks. Anything that has you lying flat on your back for long periods of time, like ab work, you can do standing abs, you can do side lying abs, but just not lying on your back. Hot yoga, if you're a hot yoga instructor and are fully acclimated to that environment, you should be fine. But for you with your physiologic changes of pregnancy, trying to do hot yoga, this may not be a good time to start something like that. You will get sweaty, you will get dizzy, you will pass out, and we don't want you to fall on your belly. Please avoid scuba because of changes in barometric pressure, decrease oxygen to the baby. Same thing for high altitude hiking. You can do high altitude visitations, so you can see your family in Colorado, just don't go hiking with them. So 8 to 10,000 feet above sea level is just fine for pregnancy. Contact sports, please do not take up kickboxing during pregnancy. We've also had some pickleball incidents as well. So anything with a ball flying at you, maybe you want to avoid during pregnancy. And outdoor biking after 16 weeks is not a no, it's just a be careful because after 16 weeks, your center of gravity changes. And as you try to turn corners, you may notice that you're kind of leaning a little bit more than you anticipate, and it is easier to fall. We have a couple questions out here. Is it true that bagged salad has a higher risk of listeria than deli meat? It depends on where you are in the country. We've had outbreaks of different things for both of those recently, so both of them are something to watch. And just be sure that you, even if it says triple washed on the bagged salad, wash it 3 more times. Cats around, how safe is that? So the cats themselves are just fine. You just should not be changing the litter box of the cats because, especially if they're outdoor cats, because there's a risk of contracting toxoplasmosis, which is a dangerous virus for pregnancy. And someone specifically just asked about kickboxing. Please don't. If someone accidentally kicks you in the belly, you will never forgive yourself, and they'll never forgive themselves either. So please don't put that sort of guilt on whoever that is. They kicked a pregnant woman trying to box. That would feel awful. Now that we've talked about diet and exercise, can you prevent gestational diabetes with just diet and exercise? And the polls are closing in 5, 4, 3, 2, 1. Excellent. All right. So some of y'all are getting hip to my question here. The answer is no. You can manage diabetes with diet and exercise, but you cannot prevent it. So most of you thought that you could, and I'm going to explain to you why you can't after I answered this question. Let's see. Oh, you meant gym kickboxing with a bag. Oh, yes. As long as no one's kicking you, then that's fine. Just that should be fine. If it's is it safe to eat blue cheese dressing if it's been pasteurized? As long as it's pasteurized, you are just fine. Okay, excellent. All right, so next, glucose screening. Why do we screen everybody? Because your number one risk factor is your placenta. You know how we blame our hormones for like everything? This too, girl. So your placenta gives off hormones. And those hormones tell your body, tell your insulin not to do its job. And the job of insulin is to clear your bloodstream of excess glucose. So if your insulin's not doing its job, then you have excess glucose circulating, which is diabetes. But it's diabetes because you're pregnant, because you have a placenta. So if you can do this pregnancy without a placenta, then I do not have to screen you for gestational diabetes. But if there's a placenta in there causing trouble, then I do need to make sure that it is not creating a situation where you have excess glucose. And if you have twins, you have two placentas. So I'm definitely going to screen you. For my moms who say, but I never eat any carbs, Dr. A, you eat fruits, you eat whole grains. Don't avoid those prior to the test because you don't want to give yourself a falsely elevated one by shocking your system with the test. If the drink itself is what gives you pause, don't worry, I've got you. Here at the office, we have Simply Pure, which is a drink that you can purchase. It is soy free, it is dye free, it is gluten free, BVO free, kosher, vegan. It's offensive to almost no one. And then on that box that I clicked on the website that we didn't go through specifically, there's also fresh tests and glucoorganics and glucose tabs. So there are links to those things on there as well. I will tell you they are always on back order, so you may want to go ahead and order them around your 20th week. If you plan to do one of these alternative drinks, let us know because Quest has a policy of not accepting outside drinks. We'll have to send you to LabCorp and we'll give you the instructions like don't open it before you get there, all that good stuff. And we have to write it on the lab slip that you're bringing your outside source. All right, preparing for birth. So some of you are going for unmedicated deliveries. And some of you are just trying to hold off the epidural so that it doesn't limit your mobility and your activity in labor. So these are some method classes. There's hypnobirthing, hypnobabies, there's Bradley, there's Lamaze. And so these are just for informational purposes, but it's a good place to start your search for if you're planning to do any of those. Question I do have out there is, can we continue to diffuse essential oils? The internet likes to scare me about it. So yeah, you absolutely can. So lavender is a really good one. Citrus is good for energizing you. You want to stay away from clary sage though until late third trimester. Good question. Breastfeeding classes, again, we do have them at HCA. Sonia's a lactation consultant and she is phenomenal. You can sign up for her classes. Every new parent should know CPR. There's a link here for Red Cross to take a CPR class. And if you're already seeing a chiropractor, good for you. Be sure that he, she, or they are Webster certified. And if they are not, just know that the Webster certification is a special add-on for chiropractors, and because pregnancy does change some of the alignments, and just make sure that they are adjusting you appropriately for how pregnancy changes you. Wondering how many of you are planning to work with a doula. Let's see. We'll stop sharing that one and launch this one. So how many, I know there's some of you who already have your doula out there, and I was really impressed before 10 weeks you had a doula. All right. Cool. And we will share our results. Well, this makes me happy. More people than not are going to be working with a doula. All right, fantastic. So, and there are some who were unsure. And that's good because I'm here to tell you what a doula is for. So, doulas are there to provide emotional and physical support before and during and after pregnancy. So, when you're in labor specifically, they might help you to get it into different positions that help baby to rotate and get into the pelvis. It may help to relieve some of the discomfort and help you to relax during labor. Your care provider teams, you're like, wait a minute, but I have a midwife and I have a doctor and I have a nurse. Well, I need a doula too. So remember, all of those people are part of the care team for everybody on the unit. So your midwife might be managing 3 labors at the same time. That's not uncommon because babies come in waves. Like nobody will come in for 3 days and then y'all come in arm and have 5 babies in a 24-hour period. So your midwife may not be at your bedside the whole time, but your doula is your dedicated person who's there from the time your labor starts. The best ones will like come to your house and tell you, all right, yeah, it's time to go to the hospital. Or they'll meet you at the hospital immediately and they stay with you until that baby is out and latched. They're not clinicians, so they're not there to give you the medical advice or provide medical care. They're there to help you process your feelings about the care that you're receiving, to help you formulate questions for us. We're your medical team. So they're not prescribing medications, and if you call us in time, they're not delivering your baby. Doulas don't want to deliver your baby. They want us to be there to do that. They just want to get you comfortable for it. So ask your midwife who her recommendations are for doulas. We just had an amazing event with them the other Friday. And so everybody here knows everybody now. We do recommend acupuncture toward the end of pregnancy and massage as well. Some places will require a note to do it to let us know we have a pre-printed pregnancy massage note. A lot of them won't do it in first trimester just because of the independent risk of miscarriage in first trimester. It's not a risk, but they just don't want you to associate those two things. Many of your insurance companies do cover breast pumps. So if we have a QR codes, please do not go find your own company and write to them and go through all the hassle of trying to find out which one is covered. The QR codes in our exam rooms, just scan them. Around 20 weeks is a good time to do it. You'll have plenty of time to get your breast pump. Put in your insurance information. They will check your insurance, send you a list of what's covered, write a prescription for us, and just send it for us to sign and send back. Recently, there's been an uptick in people trying to find their own companies and do it, and it's a lot of extra footwork. This is a really easy company. I don't get any kickbacks from doing this except for you save me and you lots of hours of time trying to fill out their long forms. This one is very, very easy. If anyone in your family needs to take Family Medical Leave Act time away from work, we are contracting with Leave Guru, which is a third-party vendor. Anyone who's ever had to get FMLA papers from doctors before know it can take a couple of weeks to get them filled out. Lead Guru does it when in an automated fashion, and sometimes it's as quick as 10 minutes, but most of them are completed in less than 24 hours. So when it is time for you to put in your FMLA, not disability, but FMLA, and be sure to talk to your HR about which one you actually need. Just let us know, and Sierra can facilitate that process for you. After you deliver, my mom's who had any issues with blood pressure, because 1 in 8 to 10 women will have some issues with blood pressure in pregnancy that they never had outside of pregnancy. We bring you back in the office a little sooner because preeclampsia, which we hear about, is actually most dangerous postpartum in the first 14 days after you deliver. For those who had a belly birth, you come back for your incision check at the 2 week mark and then routine mental health screening. So baby blues occur in about 80% of women. If they persist beyond the first 14 days after delivery, we may be looking at postpartum anxiety, depression, or rage. And those are things we want to get ahead of with screening. Postpartum doulas, if they're there for emotional and physical support, oh my gosh, when more do you need someone than postpartum? And there are postpartum doula services that will come and let you sleep, and they will straighten the house and they will feed the baby overnight. So just ask the midwives, because again, these are amazing resources that we didn't have in JAX 10 years ago. The Motherhood Space is another grant that we are one of 5 cities in the country that has. This is a collaboration between Baptist Health and the YMCA. And it's mother therapy. It's therapists there 5 days a week at the Y. They have childcare for babies from 6 weeks to 12 years of age, while you do yoga therapy, light therapy, and meetings with psychologists, group and individual. And then pelvic floor therapy, which we have here in the office. So if you're in network with us, we have a nurse who comes in 3 times a week after you deliver at about the 8 week mark. You come in every week for 8 weeks. This is standard of care in many other countries, and America is working on it. But yes, we will take care of that, and that helps with a lot of the incontinence and some of the discomfort for intercourse after you deliver as well. If you had a laceration and a repair, pelvic floor therapy is there to help. So random frequently asked questions, we're almost at the end here. You can sleep on your left side, your right side, or your back. If sleeping on your back makes you wake up dizzy, you can get one of those wedge pillows and put it under your hip, like off of Amazon, keep you from rolling flat on your back. You can help paint the nursery as long as it is well ventilated or you're wearing a mask. You can take probiotics and prebiotics. You can dye your hair, including your eyebrows. You can do gel nails. If you're in a salon with a lot of fumes, you may want to wear a mask so it doesn't make you dizzy, have you pass out. Car travel is fine up to 37 weeks. Remember, 37 weeks is full term. So again, your baby doesn't have a calendar and you might go into late. Like, it's not dangerous to travel after 37 weeks, except that you might not deliver at full circle. And who wants to do that? Just be sure you're getting out and stretching every couple of hours. Flight is also fine for my twins up to 32 weeks, for my singletons up to 36 weeks. Beyond that, you'll need a note from us saying that flight is okay. But if you are going to fly, please be sure that you are wearing medium compression hose, doing lots of toe raises in the seats to make sure you're not developing blood clots in your legs, and staying very, very well hydrated. With regard to skincare, you can use your salicylic acid, your benzoyl peroxide, most of your topical things, as long as they do not contain retinol. And a natural alternative to retinol is bakuchiol, Bakuchiol. It's found in some natural products, and it has the good effects of the vitamin A without the harmful effects to the fetus. Because you guys are going to be pregnant over the summer, random frequently asked, no roller coasters and no water slides for you. I'm so sorry. The question is actually a statement. We can sleep on our back. Yes, you can sleep on your back. And if so, it's the best news ever. Well, then I just gave you the best news ever. All right, last thing is we talk about upper respiratory, because as you can see, it says 2022, but since this, we've also gotten RSV, and then the flu came back too. So this really applies to almost everything, but a couple of things specific to COVID with regard to the vaccines. ACOG strongly recommended them. So if you plan to get a booster, Moderna and Pfizer are fine. We don't recommend Johnson & Johnson because it has an independent risk of blood clots. So for your booster, if you're more than 6 months past the Moderna or Pfizer, or more than 2 months past the Johnson & Johnson, you can get a booster, but just don't use Johnson & Johnson. Mixing and matching is okay. If you're getting your RSV, again, I think most of you are doing like October or what have you, so you may not even be pregnant during flu or RSV seasons, but there's no optimal timing versus those two things. Tdap, the tetanus, diphtheria, and acellular pertussis is usually in early third trimester, and there's no optimal timing against those. Maybe 2 weeks apart, just so you're not sore. If you do get COVID or RSV, there are no recommendations for ivermectin, azithromycin, or Plaquenil, but we do recommend one, not coming in here. Please don't come in here, and also please don't come in here. Convert to a virtual appointment so that you don't get my staff sick, because if we're all sick, we can't take care of you. And we do recommend vitamin D3, zinc, and vitamin C in these doses. If it's COVID specifically, we recommend a low dose aspirin from the time of diagnosis, unless you're diagnosed after 36 weeks. We found that COVID has increased rates of gestational hypertension, and so taking the aspirin reduces that risk significantly. Also with COVID, we've seen growth restriction likely due to the risk of gestational hypertension, and so we will follow baby's growth until delivery. If you do contract any of these, you can stay at home and do supportive therapy. On the website, there were medications for congestion and for colds and runny noses and all that, sore throat and all that stuff. You only need to go to the hospital if you're having trouble breathing or you have a fever that you can't bring down with the normal amount of Tylenol. For those of you who had your last baby, during COVID and you're freaking out about going back to the hospital, take a deep breath. We are normal again. You can have 4 visitors in the room, plus your doula, who does not count as one of your visitors. She's part of the birth team. We're not routinely masking in the hospital anymore unless you are actually physically positive for COVID or RSV while you're in the hospital. And even if you do have either of those, we're not separating from your baby. We are giving you an isolette to protect baby from your respiratory droplets and giving you an N95 mask. And the question that I have here is melatonin safe to take for sleep? Yes, and it's actually on the website. It's one of the things that is listed on there, I believe. All right, we are finished. So my last poll question on the way out is, what can you find on the website? Do you see the birth plan template? Do you see safe medications, what to expect? Or are you a stellar test taker and you know to read all the way to the end? And the polls are closed in 3, 2, 1, done. Awesome. You guys are fantastic. All right. We are social. So please follow us on all of the things. We are starting to post again. We took a little break from it, but we have all of these things out here and we may start telling stories again. We have not advertised the whole time that we've been around. So you probably heard of us from one of your friends. So we thank them and we can't wait to hear your amazing rock star birth story. So thank you all for your time today. I appreciate you. And we know that you have lots of choices in Jacksonville for where you can deliver, but we are so glad that you chose Full Circle. So we are looking forward to seeing you and your sweet families in the office really soon. Take care, guys. Bye.